Welcome. This is a training on medical marijuana for BHRS providers in San Mateo County. My name is Dr. Leah Goldstein.
And I'm Brian Greenberg. The purpose of this training is to help behavioral health treatment programs navigate the medical marijuana issue in regards to serving clients requesting to utilize marijuana. As you may be aware, federal, state, and local laws are often contradictory in regards to medical marijuana. We'll cover both outpatient and residential milieus, as well as issues concerning staff, and especially staff in recovery.
San Mateo County Behavioral Health Recovery Services has its own medical marijuana policy. It states that clients cannot be denied services based solely on the fact that they are taking prescribed medications, regardless of type of medication.
The San Mateo County medical marijuana policy is that the medical marijuana must be used for an illness identified by the Institute of Medicine and/or the California Medical Association, and that all clients using medical marijuana must sign a treatment agreement, which is attached to this presentation. The client also must sign an authorization to disclose or release of information between BHRS self-operated or contracted programs and the client's prescribing physician to discuss the reasons for an appropriate use of medical marijuana.
The San Mateo County medical marijuana policy requires a valid San Mateo County medical marijuana identification card that must be presented to the treatment provider. If a client currently receiving BHRS services no longer has a prescribing physician, the client may be referred to primary care within San Mateo County to obtain a primary care physician.
The San Mateo County medical marijuana policy requires that any and all clients using medical marijuana be able to participate fully in the treatment program. The use of medical marijuana must not impair the ability of the client to fully participate in all aspects of treatment. If a client appears impaired during a treatment session, the client may be asked to leave the session. And in some circumstances, being asked to leave a session may be considered a failure to comply with the treatment agreement and may result in discharge from the program.
There are critical differences in the policy in regards to residential and outpatient or day treatment programs. Specifics to residential treatment are that clients may not smoke medical marijuana while participating in any aspect of the program. To avoid the negative impact of smoking marijuana on others, clients will only be admitted to residential settings when their medical marijuana is administered in oral or pill form. It's commonly known as Marinol, but the clinical definition is dronabinol. In order to maximize the client's ability to participate effectively in treatment, Marinol should be taken no closer than 4 hours before the treatment session.
Please note that the consideration of patients in treatment smoking medical marijuana is only to be an option in outpatient and day treatment settings.
San Mateo County has a medical marijuana identification card program. There is a medical marijuana identification card that must be provided to treatment programs. A recommendation letter is not sufficient. The card expires after 1 year and therefore must be renewed annually. The client must be 18 years of age or secure the card with a parent's permission. Clients must apply at the Office of Vital Statistics, 225 37th Avenue in San Mateo. There is a $98 fee for the medical marijuana identification card, and that fee is cut in half for clients who are on Medi-Cal. There must also be written documentation from the prescribing physician that it is for a serious medical condition.
San Mateo County Public Health delineates specific conditions for which medical marijuana may be prescribed. These include 1. Acquired immune deficiency syndrome or AIDS, 2. Anorexia, 3. Arthritis, 4. Cachexia, 5. Cancer, 6. Chronic pain, 7. Glaucoma, 8. Migraines, 9. Persistent muscle spasms, including but not limited to spasms associated with multiple sclerosis, 10. Seizures, including but not limited to seizures associated with epilepsy, 11. Severe nausea, and 12. Any other chronic or persistent medical symptom that either substantially limits the ability of the person to conduct one or more major life activities as defined by the Americans with Disabilities Act, and B, if not alleviated, may cause serious harm to the patient's safety or physical or mental health.
One of the conditions delineated in the previous slide is cachexia. This is a kind of wasting syndrome where there is a loss of weight, muscle atrophy, fatigue, or weakness in persons who are not trying to lose weight. This is frequently caused by AIDS or pulmonary disease, the loss of body mass that cannot be replaced nutritionally, and there is some pathology present.
Marijuana as an illicit drug and marijuana as treatment are two different issues. Smoked marijuana is the most commonly used illegal drug in the nation. THC is the main psychoactive ingredient, and there may be more than 60 psychoactive ingredients in smoked marijuana. Marijuana, like other drugs, has therapeutic uses, but is also vulnerable to abuse.
Nationally, about 1 in 7 admissions for drug treatment list marijuana as their #1 drug of choice. The propensity of treatment admissions on the national level, there is 21.9% that are admitted for alcohol, 17.8% admitted for alcohol plus another drug, and 16.1% admitted for marijuana, again about 1 in 7.
San Mateo County mirrors the national statistics. About 1 in 7 admissions here are also for problems associated with marijuana. Obviously, many people who use marijuana become dependent on it.
Marijuana as treatment. Hard to ascertain the correct dosage with smoked marijuana. And again, because of this, the potency would be unknown. Smoked marijuana enters the bloodstream immediately, and the therapeutic and psychoactive effects are usually felt within minutes. The peak of those effects are at 20 minutes. As a result, users are the ones that may determine their own therapeutic dose. Marinol is preferred to smoked marijuana for many reasons. Perhaps the greatest argument for Marinol is that dose can be measured and controlled. The potency of smoked marijuana can only be guessed.
Marinol or dronabinol. Marinol is the only FDA-approved synthetic cannabinoid. It's a synthetic THC, and it's a Schedule III controlled drug, so it has less potential for abuse than drugs or other substances in Schedules I or II. Marinol has currently accepted medical uses in treatment in the United States. The dosage is between 2.5 milligrams to 20 milligrams per day. Marinol may lead to moderate or low physical dependence or high psychological dependence. It's clearly preferable to smoked marijuana. It's the only form of THC that may be used in residential treatment programs.
Please note that only adults may have a medical marijuana identification card that is recognized at BHRS treatment facilities. Medical marijuana identification cards may be obtained by minors with parental signature. However, in almost all instances, only adults may use medical marijuana in BHRS programming. It is important for programs to require that the medical marijuana identification card is up to date, and that there is a release signed by the prescribing physician, as well as a treatment agreement that is reviewed with the client. And again, there is a handout available for your view.
In short, it is recommended that pregnant women not be allowed to utilize medical marijuana in programming. Although the research is not conclusive, allowing pregnant women to utilize medical marijuana in program might leave programs vulnerable should the delivery be difficult or the infant suffer seemingly negative effects. Furthermore, in regards to treatment considerations for women of childbearing age, there's no definitive studies contraindicating use during pregnancy. There are some studies that attribute marijuana to a slightly lower birth weight, and there are other subtle negative effects that may include sleep disturbance, impaired visual problem solving, hyperactivity, impassivity, inattention, increased delinquency. But the potential and confounding risks probably outweigh any potential benefit. So the recommendation is not to allow pregnant women to use Marinol or smoked marijuana.
The same is true for mothers who breastfeed their infants. Medical marijuana in any form is not recommended for breastfeeding mothers. THC, the active ingredient in marijuana, is transferred into breast milk, and levels can be higher than in the mother's bloodstream. Although there are no differences in growth, mental, or motor development at age 1, there are also no long-term studies looking at this phenomenon. The American Academy of Pediatrics considers the use of marijuana and Marinol during breastfeeding to be contraindicated.
Although there are many legitimate prescriptions for medical marijuana, this is a largely unregulated field. As medical marijuana continues to be illegal at the federal level, physicians who prescribe medical marijuana are generally not monitored by any oversight agency. Attempts should always be made after a release of information is secured to contact the prescribing physician or the physician who signed the recommendation letter. Of course, the prescribing physician may not be available to the BHRS program. In that case, program should check the list of accepted diseases or symptoms for which medical marijuana can be prescribed. It is recommended that a second opinion be garnered and that you attempt to identify another doctor to prescribe alternative medications. And BHRS staff are always ready for a consultation.
It is San Mateo County BHRS policy that clients should not be discriminated against or denied services because of any prescribed medication. However, the behavioral expectations for persons on medical marijuana, just like those on methadone or any other psychoactive drug, are similar. Clients should be able to participate in treatment fully and appropriately. Clients should not smoke marijuana or ingest Marinol within at least 4 hours of coming to a clinic. At no time should clients look under the influence of marijuana. Similar to narcotic replacement therapy, or methadone, and a policy in BHRS, there should be no nodding, no one under the influence, no sharing, trading, or possession on premises, no glorification, and not be identifiable by sight, smell, or behavior.
Substance abuse recovery programs, and to a lesser extent mental health programs, may have staff persons in recovery. It is important that all staff work to not stigmatize individuals who are prescribed drugs that are vulnerable to abuse. It is also critical that staff are supported in their own recovery and have an opportunity to discuss their thoughts, concerns, and feelings outside of the clinical environment. The staff perspectives present challenges. Staff may have the attitude when individual clients or patients are smoking that this place is going to heck. There are challenges. Staff may believe that this person has many barriers to recovery and prescribed marijuana or use of medical marijuana is simply another challenge for the individual client. Staff may also believe that clients are gaming the system, that this is only a manipulation to be able to use a psychoactive drug while in treatment. Finally, staff may believe, rightly or wrongly, that marijuana is simply another addiction and that the client is avoiding this issue as part of his or her treatment.
For most individuals whose use of Marinol or marijuana has been approved, the use should be viewed and monitored as a clinical tool. Many individuals present with complex and challenging issues with significant barriers to positive treatment outcomes. Medical marijuana may be prescribed for legitimate health concerns and may help individuals be retained in care. It is therefore important for staff to be able to view medical marijuana for many patients in a positive light, to again see it as a clinical tool that might help engage clients and help them remain in treatment, that they may benefit from the treatment in spite of their medical marijuana, and that this is not being prescribed as a recreational drug, but for a legitimate health concern.
Toxicology or urinalysis screening may be a critical part of an individual's treatment plan. Drug testing for persons on medication or medical marijuana can continue to be used as a clinical tool. Programs may or may not decide to review THC levels for any individual client. And programs may plan for or monitor declines or anticipated declines in medical marijuana levels as clients are engaged in the recovery and treatment process.
In order to successfully integrate individuals on medical marijuana and other medications vulnerable to abuse, several issues must be considered and monitored repeatedly over time. These include making sure that the treatment milieu is a safe refuge for all clients. Integrity of the treatment milieu is being maintained. That the culture and the values of the treatment program need not be compromised in any way. And to assure that staff have the opportunity to professionally air their concerns and that in the treatment environment they adhere to the agency and San Mateo County medical marijuana policy.
Thank you.